I'm Jennifer Martin, host of Franklin County Home Health Agency's Where the Heart Is. Franklin County Home Health Agency is a nonprofit home health care organization that has been providing services to people of all ages throughout Franklin County since 1969. Its programs and services have grown dramatically since its beginning, and its commitment to our community remains as strong as ever. The agency is proud to bring this show to our community, dedicated to educating you on the benefits and services of home health care, as well as providing valuable wellness information to help you stay safe and healthy at home, which is part of what we're doing today when we talk about Lyme disease. Today we'll be discussing Lyme disease, its symptoms, treatment options, and of course precautionary measures that you can take to help protect yourself and your loved ones at home. On today's show, I have with me Lynn Crosby, a registered nurse with Franklin County Home Health Agency, and Lynn is educated in Lyme disease and serves as a resource both for our community and in our agency. And Susan Shinnick, who is a leader in a support group for Lyme disease in Chittenden County, and also has personal experiences that you're willing to share with us today. So I thank you both for coming here and talking about this important topic of Lyme disease. So let's start by defining what is Lyme disease and how is it transmitted?
It's a tick-borne disease, so that tells you how it's transmitted. So if you discover a tick on you, you certainly want to get it removed as quickly as possible and call your doctor.
Now, can you talk a little bit about the ticks, the type of tick that spreads Lyme disease? Because we know that there are different ticks in the area, and they might do, which one are we really concerned about with regards to Lyme disease?
Well, as far as I'm concerned, with family and friends sick, any tick that's on you, I'm not familiar with the type of tick, and I have pictures here of the different ticks, but if you have a tick on you, I would certainly get it removed quickly, save it, and take it to the doctor with you.
Better safe than sorry,
And
right?
it's important to remove it by its head, not by its body, because if you grab its body, you can inject all that Lyme into you.
Okay, so you're talking about how it's transmitted. So a tick, once, they do talk about there are dog ticks and deer ticks. So the black-legged or deer tick is the one that transmits the disease.
Also the dog tick.
And the dog tick can.
Yes.
Okay, so like Lynn said, just be aware in our area that if you have a tick on you, take precaution. So, so you're saying it's spread by, once it's bitten you, transmitting this disease into your body. So let's talk then about, if you think you've been bitten, what to look for and what to do.
You look for the rash, which you don't always get. In a lot of cases, the statistics say, here, the ILAD statistics say fewer than 50% of Lyme disease patients recall a tick bite, and fewer than 50% recall the rash. So you may not even know you've been bit, but if you have had a tick on you, then you obviously do know you've been bit.
Now the rash, I can never say the name right myself if either of you can.
Erythema migrans, I believe.
Erythema migrans, you see it as an EM. Explain that rash. We can probably put up a picture later, but what does the rash look like?
Well, they say it's circular and it has kind of different rings. Some are lighter and some are darker. Is that how you would
They call it a bullseye because it looks like a bullseye.
But it can be in different areas on your body. It could even be in your hair, or it could be around a leg, and it wouldn't necessarily look like that bullseye rash when it's in those areas.
Sure, yeah. And again, to reiterate what you said, that you may not always see that rash, so don't be confused that if you see a tick on you and you don't get the rash, that you're safe.
Right.
Okay.
14% of the people who answered our survey in our support group saw the bullseye rash.
14%.
Only 14%.
Okay. Do you know any more about that rash as far as once you've been bitten, when it occurs, or?
It can occur right away, or it can occur
anytime,
a month or two after.
Okay. So if you are unaware of being bitten and all of a sudden you see this bullseye rash, get to a doctor and have this conversation about
You're
Lyme
one
disease.
of the lucky ones if you see that.
Right, because you will know. Okay, so let's say you see a tick on you. How might you find a tick? Let's talk about tick checks.
Okay, well, myself, since I've had family and friends sick, I've been more aware when I'm outside gardening or mowing the lawn, and I'm always careful. I have a place in my basement where I keep my spray that you use permethrin spray on your clothes. This is actually lice spray, but you can buy it Sawyer's brand on the internet, and it's a 0.5 5% permethrin. You do not spray that on your body. You spray that on your clothes. So when I'm going to go outside, I even spray it on my tennis shoes and let them dry, and my socks. And then if I'm wearing shorts, I'll still spray the DEET on my legs.
Okay.
And then if I'm gardening and having my hands in the dirt pulling weeds, I'll spray my gloves and let them dry with that. And this, from what I understand, actually kills the ticks, where the DEET just kind of discourages them.
Okay, so permethrin, don't put it on your body, but it's a good barrier for your clothing and things that you will have outside.
And it actually will stay in your clothing for several washings.
Okay.
I'm not really sure how many. I read different numbers at different places, but it will stay for several washings. So I will wash my clothes a couple times, and then I usually respray again and let it dry.
Okay, and then you mentioned DEET, which we're all familiar with as part of an insect repellent. To be careful with children on the amount that you use, or do you have any comments on that?
I don't know. I guess I would talk to your doctor.
Or to read the back of your cans and things. But those are the best barriers as far as spray. Right. Now, we're talking about looking for ticks. You did mention some areas you might find. Is there a common place you get a tick bite? Or
places you wouldn't suspect it, around here or on your scalp or different places. But after I've been out gardening or mowing, I come in and I shower immediately, and I throw my clothes in the washer and dryer, because the dryer itself will kill any ticks that are on them that you might not see. Usually they say wear light clothes, and if you wear pants, tuck them in your socks. So that's always a good thing to do. But I also do a tick check, and I come in and I scrub from head to toe and comb really vigorously through my hair. So if I am not seeing, hopefully they'll fall off if there are any.
Okay, so it's something to be aware of. Add to your wellness regime. You brush your teeth, you go outside, you do a tick check. So it's something you have to be aware of.
And it's always better to stay out of the deep grass, and keep your lawn short, because the ticks like to hang out in the tall grass.
Okay, so mow our lawns, keep our lawnmowers running. But that's good. You're talking about a couple things. So we talked about checking your body, obviously being aware of places that are exposed, but not to overlook areas that may not be exposed, where they may have crawled or gotten to tuck in your clothes.
That's why you tuck your pants into your socks.
And you wear the light so that you would see them.
And some of the ticks can be the little nymph ones that are they're tiny as a little poppy seed. And those are the most dangerous ones, because frequently you don't see those, and that makes it hard.
Okay, yeah. What time of year are we talking about?
Well, when it starts getting warmer. And this winter it's been warm all winter, so the ticks, I don't know that they've been killed off or hibernated much. So anytime it gets above freezing, there could be ticks.
They might be there. Okay.
Yeah, and what I was reading just recently was the nymphs are particularly out there in the spring. So right now.
Okay, so it's dangerous because the nymph can transmit the disease.
Yes, the nymph can.
And because they're so small, you may not see them, so you got to be extra cautious.
They look like a little piece of dirt.
Okay, okay. And then as they grow, how big would a tick get?
I have pictures.
Yeah, they're still small,
Yeah, and these are the little larvae and nymphal ones too when they're engorged, and adult ones.
Okay.
So
I'm sure many people have seen an engorged one on a dog or something.
Right,
so that's
and a lot of people that have
tick
pets.
Checks on
That's
pets.
another thing to be careful of. A lot of people sleep with their pets in their beds, and with the ticks becoming more prevalent in the area, it just would be advisable not to do that, or if you do, to make sure you're checking yourself.
Or protecting them. Talk with your vet about protection measures with your pet, for sure. Okay. You talked about outside grasses, other landscape issues you need to be concerned with?
Well, I do. Again, they talk about you can keep your lawn short, but you can also create a barrier if you're near tall grasses and trees areas, you can create a barrier with rocks or mulch or something at the edge of your lawn, because the ticks don't like dry areas. They like moist, wooded, high grassy areas, and so that could prevent them from spreading into your yard. Okay. That's a landscape technique to use. Some people
something
use
to consider if you have a garden near the woods or a playground. You might want to create a barrier.
We actually use landscape fabric now. I don't do any more weeding. I thought I got bit a couple years ago and had a rash and got treated for 3 weeks. So since then, we use landscape fabric all over our garden and where we have some berries also, so I don't have to be out there weeding all the time.
Yeah. Well, there's a couple benefits to that. You're not weeding. You're accessed, if they are there, there is often.
And I did get bit
from
at that time. I thought I got bit, so that prevents me from having to spend so much time in the garden.
And then, so inside you did talk about coming in and putting your clothes in the washer and then dryer and taking a shower and checking with your pets. Okay. So you have seen a tick on you. And typically they have embedded themselves, or is that how they bite? Or you might, if they're crawling on you, you can assume they may have bit you? Or?
It's possible, yeah. You don't honestly know. So I would assume and call the doctor.
Okay. So what other first measure things do you do when you find a tick on you?
Well, first you get them removed, and you can do that with a fine-tip tweezer is what they recommend, or you can buy tick, and this one looks a little worn, but you can buy things, and you want to, I'll just read it. Sure. Use fine-tip tweezers to grasp the tick as close to the skin surface as possible. You pull upward with steady, even pressure. Don't twist or jerk. This can cause mouth parts to break off and remain in the skin. If this happens, remove the mouth parts with tweezer, and if you're unable to remove the mouth easily with clean tweezers, leave it alone and let the skin heal. After removing the tick, thoroughly clean the bite area in your hands with rubbing alcohol, iodine scrub, or soap and water. So you don't want to use all those things that people, like a match or nail polish or Vaseline that people used to do. You want to get the tick removed and pull straight up.
Okay, because those things might just aggravate it, and it's got time to release
to inject into your body.
Okay.
The Lyme.
It's a bacteria that we're talking about.
Lyme is a bacteria. Okay. There are co-infections that go along with it, and Bartonella, Babesiosis, and Ehrlichiosis. And Babesiosis is actually a parasite. So it's a totally different treatment. But the other ones are bacteria, yes.
Okay, so all of those are separate from Lyme but can be transmitted
by the ticks.
So, so we're concerned about Lyme disease, but also other conditions that can arise from tick. Okay, so you want to remove it, and then you've tried to do your best to get, as they said, the whole piece out. Now, what do you do with the tick?
Well, I would save the tick in a little container or a plastic bag to take with you to the doctor. If you happen to get the rash, I recommend to people that they take a picture of it, because it comes and goes so quickly sometimes. You may not, by the time you get in to see the doctor, you may not have the rash anymore. So it's good to take a picture of it, to take to the doctor. And talking to your doctor and about Lyme disease, and if you're feeling very strongly about it, trying to see if he thinks that antibiotics are the right thing for you.
Yeah, so once you do want to have that conversation with your doctor soon when you discovered you've been
you want to call the day of.
Okay.
Yeah.
So how often or how long does it take? I've heard things about, well, if the tick's only been on you for a short while, but I think we're always thinking better safe than sorry. But they do give a guideline.
They do, but I hear different things. I've heard 72 hours. I've heard 36 hours. I've heard lots of different things. For the family and friends I have seen, if there's a tick even crawling on you, not attached, I would still be concerned. Yeah. And not even go by the hours. If there's been one on me, I would talk to my doctor.
Yeah, and when you think about it, if there is one on you, who knows if there was another?
Right.
Or you just missed it 2 days ago.
If you've been in an area to get one tick, you might have been in an area to get more than one.
Sure.
That's right.
So that's the moral. Better safe than sorry.
The symptoms of chronic Lyme are...
Let's talk about, we've talked a lot about avoiding it and what it is, but let's talk about it again, what Lyme disease is and what the symptoms are, and what can happen to people who've contracted Lyme disease.
Well, usually if you have flu-like symptoms in the summer, normally the flu is not something you get in the summer, so it would be something you want to talk to your doctor about, and especially if you'd seen ticks on yourself or you'd had the rash.
Talk a little more about flu-like symptoms.
Well, what would you say?
Achiness, headaches.
Yeah, and as it progresses, I've heard stiff, sore necks, poor sleeping, insomnia as you get sicker is huge.
There's such a long list. Do we have a list in there?
Yes, we do. Yes, we do.
Of symptoms you're talking about.
This is the book we look that has a lot of good information. Creaky, cracky joints, joint stiffness, especially in the neck, sore soles, pain or swelling moving from joint to joint, Bell's palsy, brain fog, where your brain the more you do physical or mental things, your brain just doesn't seem to want to work. That seems to be a huge symptom. Speech difficulty, forgetting things, obsessive compulsive symptoms.
Balance difficulties.
Balance,
ringing in the ears, night sweats.
Wow.
The symptoms, there's quite a long list.
Everything. Yeah. So if things are going on and you can't pinpoint other reasons for them, and so what if you have had a tick bite, you're going to be aware to look for these kind of things, or maybe your family might be saying,
if you have noticed your tick.
Right, if you have noticed, and so maybe family says, well, my mother whether it was bit. We're all going to kind of watch out for maybe some of the
Right.
speech thing or the brain fog. So you might not be aware of it yourself, but if you see it in somebody. But like you said, if you don't know you've been bitten and you're having all these symptoms, it could be a lot of things. So again, a conversation with your doctor about your
Right.
symptoms if you're
Right.
experiencing them.
A doctor was definitely the one to talk to, because in some of the information with Lyme disease, it will say often a person suffering from chronic unsuspected Lyme disease will be diagnosed as having something else, such as chronic fatigue, fibromyalgia, lupus, multiple sclerosis, Parkinson's disease, Alzheimer's, and ALS, and a lot of psychiatric symptoms too. So
Well, it's interesting because when you first started talking about getting flu-like symptoms, it sounds a little bit benign, like, okay, we can get through the flu.
Right.
But these are serious conditions that it can result in.
It is. It can be very serious and go on for years. And the longer it takes for you to get on antibiotics, the longer you have to take antibiotics to get better.
Okay, so let's talk about that. So the treatment option is?
Well, normally they give you anything from 1 day, 1 pill of antibiotics, to 3 weeks to 6 weeks for the acute form. It depends on the doctor and what they have been taught.
Situation. Mm-hmm. Okay, so that would you just got bit, you take treatment, then hopefully that works for you in the small part. But you're saying that possibly if you have gone years and you're suddenly realize it is possibly Lyme disease, you can be treated at a later time.
Oh yes,
different results, but maybe with different individuals.
It takes longer to get better. In the support group, Susan can speak to. There are people who have been sick 20 years,
Or more than 20 years.
some just a year or two.
And they're getting well.
Oh, they are getting well.
So everybody's situation is going to be different, but
Yes.
to recognize that it can be severe. So you talk about chronic conditions that you may live with. For
Right.
some people, 20 years is a long time to live with
It is.
these
It
conditions.
is.
Does it stay the same? Like if this individual has a particular set of symptoms, is that always that way for the next 20 years, or does it?
It can change.
And it frequently does. You'll have one symptom one day and another symptom another day, which is why it's so confusing, one of the reasons.
Yeah. Like emotionally, this has got to be a very draining experience. It could be if you're going through something like that. Any chronic illness, as we know, working in home health and helping people who go through chronic illnesses, there's a lot to it. More the illness itself and